maybe looking to advance your career, perhaps practice in Bahrain, then yeah, this deep dive is definitely for you. Today, our mission really is to take this pretty comprehensive resource guide for the Bahrain Nursing Prometric Test. We want to distill it down into, super clear, actionable insights. Think of this as your shortcut, a way to get genuinely well informed about this really pivotal step towards getting your NHRA nursing practice license.
Absolutely. And what's really interesting, I think, is that this test, it's not just like another hoop to jump through. It's a critical gateway. It's designed to, well, rigorously assess your nursing competence, exactly as required by Bahrain's National Health Regulatory Authority, the NHRA. This isn't just about, memorizing facts. It's really evaluating your critical thinking, your clinical judgment, areas where, frankly, nurses often feel a lot of pressure. So this deep dive will uncover all those essential details, give you insights that genuinely empower you for this whole journey.
Right, okay, so with that background, let's dive in. Let's unpack this. What exactly is the Prometric test, and what are the sort of crucial basics a nurse needs to grasp before even starting to study?
Okay, so at its core, the Prometric test has one main purpose: validating your nursing competence, making sure you meet the pretty high standards set by the NHRA. Format-wise, you're looking at a multiple-choice question exam, typically somewhere between 70 to 100 questions, and you'll have a strict 2-hour time limit to get it done.
2 hours, okay.
Yeah. And the passing score, it generally floats around 60 to 65%, but, that can vary slightly. Oh, and it's all in English.
All English, right. And the subjects. You mentioned competence, but the sheer range seems quite broad. That really speaks to how comprehensive this exam is. What are the key areas, the domains nurses need to be ready for? And maybe how do they all fit together?
Exactly. It demands a really wide knowledge base.
Yeah.
So you'll get questions on fundamentals of nursing. That's your bedrock, really. Then it builds on that. Medical surgical nursing, pediatric nursing, maternity nursing.
The core clinical areas.
Precisely. But then beyond that, there's a significant focus on psychiatric or mental health nursing, really crucial sections on infection control and safety. And of course, you can't forget the legal and ethical aspects of nursing practice. Super important.
Okay.
And actually taking the test, you've got options. You can do it online or in person at designated Prometric test centers right there in Bahrain. Honestly, just understanding these basics, that's the crucial first step. It helps you build a solid prep strategy.
Okay, so given that huge scope you just laid out, the obvious next question is, how do you even start studying for all that? Let's talk resources. How do you find the best stuff? We need to break down, the free options versus maybe some highly recommended paid ones. What did our source flag as the top choices? All right, first up, the free stuff, PDF practice tests. The guide mentions a 50-question practice PDF through Enrollware and also a 32-question sample questions document you can view on Scribd. Good starting points, right? Just to get a feel for it.
Yeah, absolutely. Good feelers. And building on that, for online free practice platforms, Practice Test Geeks comes up. It offers a free test bank. And then there's Nurse Plus Academy. They provide both CNA and RN practice tests. These are actually invaluable for just getting exposed to the question styles, the content. And yeah, they don't cost a thing.
That's a really solid base for anyone starting out. But what about those resources the guide specifically called out as highly recommended, the paid ones? What makes them different? Why are they maybe worth the investment if you're serious about this?
Right, these are definitely worth a look for, like deeper, more realistic prep. The Prometric official practice tests, you get those straight from Prometric.com. They usually cost around $15 to $35 per test. But the key thing, they include clinical skills scenarios.
Okay. More than just theory, then.
Exactly. It's not just content recall. It's about getting familiar with the actual testing environment, the question style.
Yeah.
That's a huge plus. Then you've got study.com NHRA Nursing Review. It's described as a really comprehensive nursing prep course. It's got quizzes, flashcards, detailed video lessons. It offers a truly robust kind of integrated package. Honestly, a smart mix of these free and paid resources that can build an incredibly powerful study plan for you.
So thinking about your own learning style, which of these might resonate most with you? Something to consider. Okay, so we've got the subjects, we've got all these resources. How do you actually pull it all together into a plan, a strategy? This source gives us apparently a fantastic topic-wise study plan. Sounds like it could really break down this, mammoth task into manageable weekly chunks. What's that roadmap look like?
Yeah, this structured approach is brilliant. It really helps tackle that feeling of being overwhelmed.
Yeah.
So for example, week 1, it focuses right on nursing fundamentals, vital signs, hygiene, nutrition, documentation. And it suggests using resources like Practice Test Geeks, those free PDFs we mentioned.
Makes sense. Start with the basics.
Exactly. Then Week 2 strategically moves to infection control, covering essentials like hand hygiene, PPE, isolation procedures. And for that, it points towards WHO guidelines, maybe some prometric skills resources.
Okay.
Week 3 dives into medical surgical nursing, respiratory, cardiovascular, GI systems, suggesting maybe study.com or even looking up YouTube videos for visual aids. It's not just a list, it's a logical progression.
Right, building block by block.
Then week 4 moves on to pediatric and maternity nursing, growth, immunization schedules, pregnancy stages, using those script PDFs, Nurse Plus Academy perhaps.
Right.
Week 5 is dedicated to mental health nursing, things like communication techniques, anxiety, crisis intervention,
Yeah.
recommending Quizlet flashcards or specific videos.
Still a lot to cover each week, though.
It is, but it's focused. Week 6 covers ethics and laws, consent, confidentiality, abuse reporting, citing NHRA regulations, online guides for that. And then, crucially, week 7 and 8 are all about full revision and mock tests. That's where you'd really lean on those Prometric official tests for timed practice, critical for building stamina.
Timed practice, yeah.
And if we connect this back, this structured approach, it's not just about ticking boxes on content. It's about systematically building your confidence, making sure you retain the knowledge comprehensively so you're not, cramming last minute.
That 8-week plan, it really does lay it out clearly. But thinking about nurses, maybe someone's been out of practice for a bit, or maybe they specialize heavily in just one area. Should they maybe pay extra attention to certain weeks, or could they reorder things based on their own gaps?
That is an excellent question.
Yes.
While the plan itself is solid, tailoring it is absolutely key. For someone returning to practice, week 1, fundamentals, and week 2, infection control, are often critical refreshers. Those basic skills can get a bit rusty, And for specialists, it might actually be the general med-surg sections, or maybe mental health, that need more dedicated time, simply because it's not their day-to-day focus. The beauty of this roadmap is its flexibility. You absolutely can spend more time where you feel weaker. But, and this is important, always make sure those final 2 weeks are locked in for full-length timed mock exams. That's where you really build that test-taking endurance.
Okay, endurance. Got it. Now, it's not just about book knowledge, is it? Practical skills are obviously vital in nursing. What does the guide say about the essential hands-on competencies?
Right. Theory isn't enough. You have to do it. Our source includes a skills checklist for Bahrain nurses, highlighting those key practical competencies. This includes mastering proper hand washing, specifically those critical WHO 5 moments. Knowing when to perform hand hygiene is as important as how.
The 5 moments, yes. Crucial.
Absolutely. Then, being confident in taking and, importantly, accurately recording vital signs, assisting patients with mobility and hygiene, understanding medication administration basics, and being proficient in emergency response protocols, BLS, CPR. Those basics are non-negotiable. I've heard stories where simple things like documentation errors with vitals can trip people up just because they're under exam pressure.
Oh, wow.
It's not just knowing how, but doing it right and efficiently under pressure.
And beyond just the practice, the guide also really pushes self-evaluation, doesn't it? Offering to help create a printable mock exam, 70 questions, and an Excel sheet to track performance.
Yes, and this brings up a really important question. How do you truly know if you're ready? Tools like these, custom mock exams, detailed tracking sheets, they're absolutely crucial. Not just for seeing your strengths, but more importantly, for pinpointing those specific areas that need more focus before the actual test day. It helps turn those vague feelings of, oh, I'm weak here, into actual, actionable study targets.
Makes sense. Turn a weakness into a plan. Okay, so preparing is one massive part, but what about the actual test day, the logistics, and what happens after you pass? Let's get those details squared away.
Okay, logistics. For test centers in Bahrain, the main spot is the Gulf Future Business Center. It's in Sif. Booking your test, you can do that directly through the Prometric website or via the NHRA's own licensure portal. Just make absolutely sure you have the required ID ready to go. That'll be either your passport or your CPR card. Honestly, getting these details sorted out well in advance, super important. Avoids that last-minute stress or any surprises that could just throw you off your game.
Definitely want to avoid test day surprises. Okay, so picture this. You've passed. Huge relief. But then what? What are maybe some of the less obvious hurdles or common mistakes nurses run into after passing when they're navigating the NHRA license application process?
That's such a critical point. Passing is huge, yeah, but it's not quite the finish line. So once you've passed, step 1, submit those results to the NHRA online portal. Pretty straightforward. But a common slip-up. Overlooking the exact format or maybe the updated requirements for all the supporting documents. Details matter here.
Yeah, the paperwork pitfalls.
Exactly. You need to meticulously gather and complete everything. Your degree and transcript. A good standing certificate that's from previous employers or regulatory bodies. Also, valid CPR first aid certification, your passport, a recent photo, and your residency permit.
Quite a list.
It is. Then after submitting all that, you pay the NHRA application and license fees, and then, well, there's a bit of a waiting game for the license to be issued. The absolute key here is organization and really paying attention to detail. Any missing document, or one that's not formatted correctly, it can seriously delay the whole process.
Right, so it sounds like a very thorough, multi-step process, really designed to ensure nurses are fully prepared for that professional journey in Bahrain, right up to day one on the job. So we've just walked through the entire journey, haven't we? From really understanding the Bahrain Nursing Prometric Test all the way to those final steps for getting your NHRA license, all drawn directly from that comprehensive guide.
Yeah, and what's really fascinating, I think, is seeing how this detailed, meticulous preparation, it does more than just help you pass a test. It genuinely empowers nurses. It gives you the confidence to contribute effectively to healthcare in Bahrain, making a real immediate impact. It truly sets you up not just for the license, but for, professional success there.
Absolutely. So here's a final thought for you to maybe mull over. How does continuous learning, even after getting this specific certification, how does that shape your professional identity? And ultimately, how does it impact the care you provide to patients in what's always a really dynamic healthcare environment? Something to think about long after you've passed the test and started your new journey. On behalf of the deep dive, we genuinely wish you the very best of luck in your future career. Remember, this knowledge, this preparation, it really does empower you for everything ahead.